you came up, or the medical city came up with this home care program, and apparently it makes full complete sense because less staffing, less cost, and better for the occupancy rates and availability of beds. Now, other than that, is there something that you would recommend to all hospitals and to the national government to adapt to make things better?
Is we should have more transparency on data and information that comes out of the DOH with respect to how our vaccination is progressing. And some of the issues relating to data capture don't make sense. Like, for example, you had a 5 times multiplication of active cases over the span of 1 month, and yet the number of patients deemed severe or critical hardly moved. So you do have to clean up the data and you report it transparently. So whether it's Okta or other whole of nation groups can provide support in terms of coming up with better solutions for capacity management and handling COVID.
Okay, because the data tells you or gives you a basis of projecting your response.
Yeah, and for example, if you drill down from Metro Manila all the way to the LGUs, you'll find out where the concentrations are, and you
Mhm.
can say, all right, I'm going to focus my vaccination on these areas. But unless that's very transparent and given regularly, you're not able to track that consistently.
Do you believe that there is a system in place? Because I get the impression that they're just gathering reports of laboratories. Laboratories are sending their results, but they're not indicating, okay, it's here, he got it from here, and this is the, et cetera, et cetera. I mean, the details. Is there really a system in place?
Well, I don't know. There is a system. Apparently, they clean up the data maybe every week in terms of the laboratory reporting. But how does one explain 200,000 active cases going down to 100,000 or less in 1 week? How is it possible to do that? Is it just statistical, or there are actual reports for this thing happening? It's very hard to do suggestions if you don't have full transparency in terms of reporting. And if you do better reporting, then you can refocus your efforts on certain categories, on certain geographical areas that need more help.